This video is for educational purposes. Please follow the guidelines in your country for proper management of patients. So today we are going to talk about managing a patient with status epilepticus. And if you are still new to this channel, I request you to subscribe and watch until the end, because you are going to learn something which is good. And this video is good for health workers. You are a clinician, you are a medical officer, you are a nurse. This information is so important. So let us begin with our lesson. So status epilepticus, according to what books say, is a medical emergency, okay, where someone convulses non-stop, or he convulses one fit after the other for at least a period of 30 minutes. But in my real practice, sometimes you may have someone who is having status epilepticus not according to the books, okay. You may find someone gets a convulsion after 1 minute, maybe they spend maybe 2 minutes, then again another fit comes, then from there again, after they have gained consciousness, maybe after 3 minutes another seizure comes, okay. So you may within like maybe 30 minutes, you may find someone has had a lot of attacks of seizures or epileptic attacks, okay. So that one qualifies to be status epilepticus. So we are saying that this is a medical emergency which you need to attend to very fast. And if they bring for you someone, like you're a clinician, you're a health worker, and they put for you someone in your presence and it's busy consulting, it is something that you need to think fast to understand how you can help that person. Because if you don't attend to that situation, the person's life is in risk, okay. So status epilepticus, we have said, is a medical emergency where you need to attend to it very fast, and also we have put it under psychiatric emergencies, okay. We talked last time that psychiatric emergency is a situation or a condition whereby if you have not attended to, it is going to cause harm to the patient, or is going to cause harm to others, okay. So status epilepticus is one of them. But where do we find most of these kind of things? Like me as a mental health worker or as a psychiatric clinical officer, there are patients, of course, who are having epilepsy. Sometimes when their conditions are not controlled, you find them coming with what? Status epilepticus, okay. When they have severe malaria, an epileptic person can present with status epilepticus because the malaria increases the temperatures so high. But also we can have people who have taken alcohol and you find them also presenting with status epilepticus. You can have someone who has gotten a head injury, they start getting fits or seizures, and they also become what? Continuous, okay. So as you manage someone of status epilepticus, you have to take your history very well, rule out other physical illnesses, you do some tests, you do tests for malaria, do HIV tests, correct information from history. Does this person drink? What happened? Find out what could be causing status epilepticus. Is it an accident? Is it head injury? Okay. So now we are going to the management. How do you manage someone who is having status epilepticus? Okay. Since this is a medical emergency or is a psychiatric emergency, then you need to think of emergency medicines, okay. One of the things that when you are managing status epilepticus, for example, someone is an epileptic client, you have to think of benzodiazepine. And one of the medicines that we think of is diazepam, okay. The patient can be an adult, the patient can be a child. So we think of benzodiazepine in that you have to give IV diazepam, okay. You calculate the dosage depending on your guidelines in your country. If you're in Uganda, you can look into the Uganda clinical guidelines and see how many milligrams to give. But some of us, like when you have been managing, you can say experience and say, maybe I need to give this person 10 milligrams, maybe I need to give this person 5 milligrams of the diazepam injection. But for proper management, you look into your guidelines, the clinical guidelines, and say how many milligrams per kg do you need to give this. So you give IV, then also you give bolus. You give the 50 bolus. You can give to, if it's an adult, you can give 20 to 30 milligrams. Okay. Why are we giving this? Because someone is convulsing, is using a lot of energy. Okay, the brain is not getting enough supply to the what? To the brain. And also, why are we giving the diazepam? Diazepam is a muscle relaxant. So we want to calm down, like want these muscles to be relaxed so that this person does not get the seizures. Okay? So when you give the diazepam and you have given the D50, there are 20 to 30 mils, is that you repeat the diazepam after 5 to 10 minutes. Okay? That is the time that you have to give yourself. So if you give the first dose of diazepam and the seizures are still coming, then you have to go to the second what? Dose after 5 to 10 minutes. Okay? Then also, if the diazepam does not control the seizures, then you have to look at other IV and convulsants. That is when they come in. Okay? And I'm going to talk about some of the medicines that are available in our country. Maybe in Uganda, maybe Africa, but there are other medicines that are used but they are not available here. They are available in maybe in the UK, in those European countries. They are more, they are better anticonvulsants that you can give during emergency situation. But for now, I'm talking about the ones that are available in our facilities that are already available. So if the 2 doses of diazepam have failed to manage the seizures, then we start considering, we have IV phaeton, we have IV what? Phenobarbital. Okay, so you give this medicine depending on the milligrams per kg. Okay, so if we go in my practice, I have really loved the IV phenobarbital. It has done for me great work, but I'm not saying that you should not give maybe phaeton and other things, but I'm saying that you look at the medicine which is available, and some people respond different to medication. Okay, so when you give IV or you give IM phenobarbital, it can control the seizures. So you look at the milligrams per kg. In most cases, you may find that 10 to 15 milligrams per kg. Then you calculate, you get the body weight of the patient, then you multiply, you get how much you are supposed to give IM or IV. Okay, but as you give IV phenobarbital or IM phenobarbital, you have to consider some side effect of respiratory depression. Okay, that one you can overcome it by giving some fluids like IV, like you can give some normal saline, you can give D5 running. Okay, if you are using phaeton, also you can use, depending on the milligrams, you can check in your guidelines. Sometimes it's 10 to 15 milligrams per kg. Then you calculate the dosage of that client and you what? You give. Okay? So once you give this medicine and maybe the seizures are still not yet controlled, you can now give a maintenance dose. Okay? But in most cases, when you give this medication, you find that there is improvement in the client. Like for my case, I've tried so much using the phenobarbital injection. Yeah, after within like 5 minutes, you find the seizures have what? Have been controlled. Okay, so those are some of the medicines that we have, but also we have better medicines in the UK, which are the first line treatment for status epilepticus. But for this case, we are saying that IV, diazepam or benzodiazepine, they are the first line for managing status epilepticus. Okay, if they fail, that is when we consider now giving IV phaeton or phenobarbital. Okay, so if you are still new to this channel, I request you to subscribe because it motivates me to make similar videos. And when you have controlled the seizures, now you have to do some tests like complete blood count, you have to do malaria tests, you have to do this general test to rule out other physical what? illnesses, things that could have caused status epilepticus. When is a patient who is having epilepsy, okay, maybe you find out, could it be the problem of drug adherence, which is bringing status epilepticus, or it is because this person has gotten malaria? Okay, so that is how we manage status epilepticus. In case you have any question in the comment section, maybe you have a question, which drugs do you use? Like someone can say, which drugs you use in case someone is maybe pregnant, you know? There is magnesium sulfate for mothers who are pregnant, okay? So there are mothers who are having epilepsy. Sometimes when they go to deliver, they can get status epilepticus. So we have also that medicine that is also used to managing status epilepticus in pregnant mothers or expectant mothers. So thank you so much for watching my video. If you found this video helpful, please subscribe and let me see in the comment section some of the questions that you have for me in regards to status epilepticus or in regards to our topic today. Thank you so much.